Welcome to the office. Welcome back.
Thanks for having me.
Happy Thursday. So, where are we at today?
The pain's the lowest it's been. Woke up with less pain finally.
Okay.
So that's a good start.
Okay. How's the mid-back moving?
Better, yeah.
Okay.
Walking seems to help the pain a bit. To a certain extent, then I get worn out.
Okay.
But
Worn out faster, worn out later? Or still about the same?
kind of the same.
Okay. How's the blood sugar?
Oh, it's been good.
It's been
It's
good?
pretty stable right now.
Okay, cool. Not bad, Mom. Let's continue. So what we've been working on is Thursday. We started on Monday. And what we've been working on, guys, is a few things. And we got to L5 pelvis combo for him. And that seemed to start to free up a lot of stuff here. First day was the sacrum, the tailbone. We were down here in the tailbone. And as we looked on his x-rays, we know there's some calcification going on through here and some arthritic hooks here. And all that is from some wear and tear, and I don't want to say it's hockey, but maybe it is, I don't know.
No, that's a good possibility.
You know, just a lot of physical stuff.
Or the gym too, I'd say.
I don't know that those things came from the gym.
No.
Maybe gym exacerbated if you're going really heavy.
Okay.
But you know, he's got those claw osteophytes going like this in the middle of his back, and so when he's trying to straighten up, I mean, he's straightening up a little bit better today. Right on.
There's a little crack in there.
Good. And we wanted this part to do a lot of crackling and that stuff breaking up as we're working on the low back. And when I say breaking up, remodeling, because the way I look at arthritis, you know, or osteoarthritis specifically, and I'll talk very brief about it. I have a video called Dr. Rahim Chiropractic 101. It's an old video, and I explain on a full spine x-ray. The idea with osteoarthritis, as it was taught to me when we're looking at the spine, and you can take this example to all the other joints in the body. Okay. So our first line of defense against the forces of gravity, we're biped organisms, biped. We stand upright, and we have this spine. And the spine is composed of 24 movable bones in adulthood. Okay, so this is the front, this is the back. We're designed to have 60-degree reciprocating curves, like that. Forward, back, forward. And this is our primary line of defense against the forces of gravity. When we lose our curve for any reason, whether slips, falls, trauma, posture, the second defense system kicks in, which is the muscular system. The muscular system in regards to defense will start to spasm areas that are unstable. A spasm is a protective mechanism of the body. So typically what happens when people have a spasm, let's heat it up and let's massage it and let's kind of just see if we can get rid of it or take some sort of muscle relaxer. And the way I was taught is look where the spasm is and cross the spine and ice it. Even if the spasm, let's say it's in the thigh and the muscle is spasming. First thing I would do is follow that nerve back to the spine. So if we're looking at the thigh, L2, L3, and I would be icing that area. Okay, now, why is that important? A spasm is energetically very expensive for the body. So it's going to do it for a period of time, and then it's going to just take too much energy. We're at the second defense. The third defense will then kick in, which is the ligamentous system. The function of a ligament is to connect bones.
Yeah.
Okay, now let's say we're supposed to be like this. Let's give the example. We're supposed to be like this. And let's say for whatever reason we're like this. Just the example. Now we have a straight or reverse curve happening in the spine. The muscle spasmed here to protect. And we just kind of took the muscle relaxer, heated it up, didn't really address why is it spasming. Okay, third defense is ligament. Ligament is shortening. The ligaments will adapt to this position. Stanford did a study many years ago, and they found that the body will acquire the position it's most in within a 5 to 10 year period. So if we're sitting like this at the computer for 5 years, guess what happens? That's our body. Okay, so ligament adapts. It shortens in some areas, so let's say it'll shorten in the front, elongate in the back. And now when we're trying to straighten up, it starts to pull and hurt. If we're looking at it from the side, we can see, let's say it's like this. These ligaments would go short, these ligaments would go long. And then we're trying to straighten out, and what happens? We get those pops, especially in the morning. Now, follow the process. The spasm eventually goes to become tight. We wake up in the morning, things are stiff. We get on with the day, it's okay. End of the day, it's tight again. Wake up in the morning, it's stiff. That's the ligament now, not the muscle. The fourth defense is the disc. We're still talking about defense mechanisms of the spine. The disc, now, usually if that thing went out of alignment, there's probably a vertebrae that went out of alignment that started that process. Let's talk about the disc. The disc is composed of two parts mainly. We have a non-compressible nucleus. We have compressible annular fibers. So these fibers hold this nucleus in place. And the function of this nucleus is to act like a pivotal ball bearing. The function of the disc is a spacer, and there's a little bit of shock absorbing properties. Are you okay in that position?
Yeah, that's it.
Okay, no worries. Now, this information is really, really important, okay? It's really important for everybody. Now, the spacer, the nucleus, we said is non-compressible. It acts as a pivot. It allows our 6 degrees of motion at the FSU, or the functional spinal unit. So, trauma initiates the misalignment. The misalignment, or the vertebrae, will take some of that material with it. It'll dislodge off the nucleus. The nucleus, or the disc, is attached to the vertebrae by rivets. They're little fibers. They're called Sharpie fibers. They act like rivets to hold us in place. So if the vertebrae misaligns, it's going to take some of that disc with it. If it's not sitting on its pivot for whatever reason, what happens? We lose 1 or all 6 degrees of motion. If we lose motion in the disc, just like different joints in the body, we lose that process of what's called imbibition. Imbibition means to imbibe fluid, to get nutrients and hydration in, to get rid of waste products. If the joint's not moving, it does what? It degenerates. It wears out. Okay. First defense, we've lost, so it starts like that. We lost the curve due to misalignment, trauma, posture. Muscle spasm, eventually fatigue, ligaments shorten in this position. We're trying to wake up and stretch, and we get all these pops in our back. They're not cracks. Okay, they're just ligaments popping. Okay. The disc then will start to wear out. And that's the first stages of, if we want to call wear and tear or degeneration of the disc. We have phases of degeneration. The fifth and final defense is the osseous system, or calcium and bone. And that's where the body starts to lay down calcium to stabilize that instability. Does that make sense? Calcium, for example, even in the SI joint. The SI joints, when we're looking at the sacroiliac joint, there's a synovial joint in the front, in the anterior portion here, but there's no synovial joint in the back. Okay? We have ligaments. We have all these different ligaments that hold us in place. Okay. We do have a synovial joint in the front. Guys, if you know that or don't know that. And 4th decade of life, there is natural osteophyte formation for stability. Okay? However, in the rest of the spine, I have 70-year-olds that I've seen with no arthritis. I have 15-year-olds with arthritis. So what is that? And last thing I want to talk about is that even the word arthritis is actually misused. Arthritis, by definition, is inflammation of a joint, lasts about 6 weeks. After that, it's really called arthrosis. And it's a misused word quite a bit right now. And why I'm bringing this up is terminology is important, mechanics are important. So when we're looking at why do you have these hooks there in your spine, it's because there was instability that started way back when. And the body went through these defense mechanisms to stabilize your spine. So, and I've said this for many, many years, this is my 20th year in practice, for 20 years I've been saying this, same story. If the body can lay it down, the body can take it away given the right conditions. And there are 7. Let's see if anyone can guess what it is. Okay. Now, I've seen patients, I'll probably show an x-ray at some point. I remember having a 70-year-old man who came in for an L4 herniated disc. He had an osteophyte and degeneration around T12, I think it was, something like that. All we worked on is this L4. The arthritis disappeared by itself. We didn't touch it. The point, and that was in my first year or second year of practice, and it blew my mind away. That's not what he came for. He had tightness in there, but he was coming in for a herniated disc. So the point I'm making is this, going back to your x-ray now, is we had instability. And so the idea here is we want to stabilize this foundation and we want to level it the best we can. That way you can get all the movement you need. You're young enough. The more your body will move, the less it will wear out.
Yeah.
Does that, with proper alignment, does that make sense?
Yes.
Mom, does that make sense? And that's really what I'm doing here for everybody, okay, is let's get the body in proper alignment and move it. That's number one. Okay? So I wanted to go over that. I think it's very important for everyone to understand that. And I know I'm going to get a lot of comments, slack or flack on it, but that's what it is. And you know, a lot of people are told is once you have arthritis, oh, it's arthritis that causes the pain. It's not actually the arthritis that causes the pain. The arthritis is stabilizing the joint. Okay? Let's see where we're at today. Starting at the base of the neck. We got some in the atlas today. You slept okay, you said, though, right?
Yeah, I'd say so.
Okay. All right, let's see what we got going on. Do. Mid back is clear. 4 points in L5. That's our combo. 5 points. L5, atlas, and right pelvis. Let's see how it's moving. Sit up straight the best you can. Back slowly towards me. Top of the joint. Middle of the joint. Better, right?
Yeah.
Tender. We have more range of motion.
It was way worse yesterday.
Very cool. Well, we know our combo. Let's put in. All right. We're going to set that AS down and out. Good. Holding that left side. Oh, nice.
There we go.
Proper. More slowly. Let's walk that off once. And for his L5, we have a special listing, PRS-M. Tummy down, good. Tummy up. That's PRS there. I'm going to be right on that mammillary. There you go. There you go. Come on up. Now, let's try one more. Let's see if we can go on the side today. Let's go right side down. And let's see if we can get a little more on that pull move today. So there's the PRS there. There's the mammillary. We're going to torque it that way. Let's roll through. Roll. A little more. That's it. Come on up. Okay, walk it up. One more time. I think what we're going to do today is put a lift. We're going to put a heel lift in today on his left side. Because remember we were saying that the We have an 11 millimeter MD. Correcting the pelvis, we'll get it to 7. I want to kind of just see something with him. And I just want to put it in for a day or two. I'm going to put a 3 millimeter on your left side. You're going to put it in your shoe, you're going to walk with it. We're going to see if anything changes a little faster, and it's going to give us that information that we need. Okay? It's not going to be forever. All right? We're going to do a 3 millimeter today.
Perfect.
Cool. Head down, please. Clear it up top. Sit up straight. No clear. Come back slowly towards me. Look at that. Is he making a face?
No.
Look at his face. No face. No. 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 Nice.
Look pretty.
What's that?
You gotta look pretty.
Oh, come on. It's not hurting like yesterday.
No.
It's moving way
No,
better.
he's not wincing.
He's not wincing
No.
today.
No.
That was
It's a
the
little
word.
tender
That's actually the
still.
word I was looking for.
Way better.
Go on your back, please. All right. It's a new one, so it's tougher than what I'm used to. More firm. There you go. Awesome. Come on up. Turn and let's buff out that back just for a minute. Doing great. Squeeze. Squeeze. Just a tiny bit in the wrist today. Relax the elbow. There you go. Squeeze. Enjoy your Thursday.
Thank you.
You're very welcome.